Greetings of the day, everyone. I am privileged to welcome you all into the Health Talk series organized by the Student Council of Sadabai Raisoni Women's College, supported by SGR Knowledge Foundation and powered by Raisoni Group of Institutions. Practice good dental health is important to maintaining a healthy mouth, teeth, and gums. It will also help your appearance and quality of life. We can say that our overall health is directly proportional to our dental health. Better dental health leads to a better health, and better health means happy life. Preserving your pearly whites, dental care requires only minor steps to avoid serious problems with your teeth and gums. Brushing and flossing regularly, but routinely seeing a dentist is the only sure way to identify and treat problems. So, to save our pearly whites, we have a dentist with us, Dr. Rashmi Dhale. I welcome you, ma'am. The
Hello.
topic, hello, ma'am. The topic of our session is importance of oral health on overall health. So, let me introduce our speaker. Dr. Rashmi Dhale is BDS, MDS in periodontics and implantology. She is a consultant dental specialist and having the experience of more than 12 years. She completed her post-graduation from Government Dental College and Hospital from Aurangabad and was a lecturer there in the same college for some time. She took her advanced training in implantology from various institutions in Mumbai. She has special interest in gum disease management, gum surgeries, dental implant surgeries, and smile designing as well. I welcome you, ma'am, in our Health Talk series on behalf of all. I welcome you, ma'am.
Thank you so much, Maria. Hello, everyone. I'm thankful to the foundation for this wonderful opportunity. And thank you, Maria, for this warm welcome. Uh, in my past 12, 15 years of practice, I strongly believe that there is a strong correlation between oral health and overall health. We all know that oral health has got impact upon how we eat, the way we speak or communicate with each other. It also has an impact on our confidence and our relationship. But we hardly know that there is a strong impact of the oral health on our overall well-being. See, we know that the cardiac disease, the heart disease is the leading cause, one of the leading cause for death in our country. But do we
Yes.
really know that oral health has got a huge impact on the cardiac health as well? Our oral cavity has got plenty of bacteria, good as well as bad. So the teeth are always surrounded by a thin sticky film of this bacteria constantly. So oral cavity and the gums are under constant challenge of this bacteria. As the bacteria build up, the threat increases. And at some time, at some point, our host gives up. So at that point, this bacteria can invade the host system. Here, like for example, if you don't brush properly for some time, the plaque is going to increase. It's going to build up on your tooth. So
Yes.
the bacterial count is going to increase. Once it increases and it evades the host system, it can transmit through the blood vessels to entire body, right? The gum
Yes.
tissue is supplied with the blood vessels, and once the bacteria enters in the blood vessels, it will go to the heart, lungs, and again to the heart and will be pumped to the rest of your body. So in such situations, it can lead to cardiovascular diseases. It has been proved and it has been seen in many series of certain studies wherein they have found that these bacteria, as they roll up in the blood vessel, they form a plaque-like thing and they attach to the inner walls of the vessels and they form an atherosclerotic plaque. And that is how they can occlude the vessel, they can block the blood vessel. Similarly, if certain individual has got certain prosthetic component placed in their heart, right? If, for example, a prosthetic heart valve, these bacteria can colonize on that prosthetic heart wall as well. So it can lead to bacterial endocarditis in such patients. We have also seen certain lung diseases more in cases wherein the patients have overall poor oral hygiene or some gum problems underlying. These plaque or these bacteria through the blood vessels can transmit and can go to your brain. So you can have the cerebral arterial occlusion as well, leading to a stroke or brain stroke that we call. But this is not all. No, this like this bacteria go and they spread at certain places. That's not all. We know when there is bacterial invasion, our host tries to defend. Body tries to defend. While defending these, body creates certain pro-inflammatory or inflammatory mediators. Certain enzymes are secreted in the body. So all these chemicals and enzymes will prone your body for other problems. Like for example, if a pregnant lady, you imagine she has got a lot of bacteria and a lot of plaque and tartar in her oral cavity, what do you think she can have, right? Because in pregnancy, there is increase in the level of hormones, especially the progesterone. And the progesterone is a very good food for the bacteria called P. gingivalis. So we expect a huge increase in the colonies of P. gingivalis in the lady's mouth, in the pregnant lady's mouth. So if she has these bacteria are notorious and they are known to cause troubles in the gums. So they are going to cause problem with the gums. It is going to cause a pregnancy tumor, like the small enlargement on your gums. It can lead to redness of the gums. It can lead to overall generalized swelling of the gums in the pregnant lady. At the same time, if this bacteria evade the host, it will lead to release of the inflammatory markers and pro-inflammatory markers, and there will be release of prostaglandin. This is released from the host, from your body. So now we know that pregnancy may prostaglandin levels goes on increase and it is at the peak when there is a labor. So if you have prostaglandin already increased in your body because of some oral infection, you are going to get a higher levels of prostaglandin in your body before the term, right? So this pregnant lady can land up in labor before the term because of increased levels of prostaglandin in her blood. And she can deliver a low birth weight preterm baby. There are several studies which have proved this. When they have found out the studies wherein they conducted a study where the females has got disease, the periodontal disease, and other females who were having normal periodontium. In these females, they conducted a study. They found out the chances of preterm babies is more in cases wherein the oral condition was bad. So pregnant ladies definitely need to be more cautious about their oral health for their themselves and for their babies. And one more important thing, if we consider the correlation between these two, between various diseases, we know diabetes, right? Diabetic patient has a higher chance of getting oral infection. They are very prone for gum infection, and the kind of gum infection they have is like more severe form. Like they will have increased amount of bone loss in a shorter span. They will have more chances of abscess formation as compared to normal patient. So diabetes has got huge impact on your gum health, on your oral health. So if you have a higher sugar levels, your gum health is going to be bad. So this is one way of relationship. But diabetes and gum health is a two-way relationship. Like if you have bad quality of your gums, if you have poor oral hygiene, if you have infection in your oral cavity, then your diabetes control is going to be worse, right? The sugar levels are going to be higher. You need more insulin or more medication to control the diabetes. So I personally was a part of many studies that were conducted, and this is now proven fact. We experience this in many patients, many diabetic patients, that when we treat this disease, when we treat the gum disease, their insulin requirement goes down drastically. They sometimes don't need the medication at all. So now this is a proven fact that diabetes can be very well controlled by controlling the oral infection. So that is why I always say, like when you have a disease in the oral cavity, it is not just limited to the oral cavity. It is going to affect your entire body in several ways. Yeah, Maria.
Yes, ma'am, you said well. Oral health is really very important for us. If we want to keep our body healthy, we have to keep our oral healthy first. Then only we can do it. So, ma'am,
Right.
I have some questions. I'm curious about it, so I have some questions.
Right.
Um,
Yeah.
Ma'am, what precautions should be taken to prevent decaying of teeth?
Right. So decay of the tooth is one of the most common dental problems. So there are two most common dental problems. One which is associated with the tooth is dental decay, and another that is associated with your gums is gum infection, gingivitis and periodontitis. So these are very common, most common dental problems. So when the tooth decay, what the tooth is made up of two components, right? The crown portion, the portion that is visible in the oral cavity is called as a crown. And the second portion that is embedded in the bone, it's called as root. So if you see the cross section of the tooth, it has got layers. The outermost layer that is present on the crown is called enamel. Now, enamel is very strong structure and it is going to resist most of the acid attack. The second layer is called dentine. Now, dentine is the tubular structure that has got fluid, that has got some sensitive nerve endings. And the center or core of the tooth is called pulp. Now, pulp is the structure that is vital. It has got nerves and vessels. So, if the root is concerned, it has got the pulp as well as dentine. But instead of enamel, it has got cementum that helps in the anchorage of fibers. Now, what happens if tooth gets decay? First, the bacteria will invade the enamel. Now, it is very difficult for them to invade the enamel, so it takes a lot of time. So, if we can just arrest the caries at that time, it is very much beneficial. Once the bacteria penetrate the enamel, they can easily destroy the dentine and go in the deeper layers. So, in order to prevent these caries, what is most important is to brush the teeth nicely. You must know the proper brushing technique. So, we have never taught the brushing technique properly. I think somewhere in our school we were taught about the Folds technique, the round brushing technique.
Yeah,
But that
yeah.
doesn't hold true once you grow old, right? You need to implement a specific brushing technique. So you need to visit your dentist and understand the proper brushing technique. Secondly, you need to brush twice a day at least. With brushing, what we do is we clean the surfaces of the teeth, but we still are not cleaning the interdental area. That is the area between two teeth. So for that, you need to use a floss or interdental brush depending upon the space that is available. When you are choosing a toothpaste, it has to be a fluoridated toothpaste. For general public, the toothpaste should have 1000 ppm of fluoride at least, right? So that fluoride is an element that has got anti-cariogenic properties. It is going to prevent the caries. So at the beginning, if you're brushing twice a day with the fluoridated toothpaste and you are cleaning the interdental area, you're like good to go. I mean, this maximum can be done. This is the maximum that one can do. In addition to this, if you have specific problems, then you need a specific care, right? For kids, we
Yes.
usually do not advise a fluoridated toothpaste before the age of 2 because at that time they don't know how to spit and there is a chance that they will swallow the
Oh.
toothpaste. So before 2 years of age, the fluoridated toothpaste are not advisable. After that, for all the ages, fluoridated toothpaste are must to prevent the caries, right? Apart from that, there are certain food choices that you can make. You can, instead of consuming more refined or sticky food, you can just choose the raw food, the salad. You can incorporate more of a salad and raw fruits or vegetables in your meals. That is one good way of preventing the caries because these food which has got high fiber content are natural cleanser of the teeth, right? So the teeth will get cleansed naturally and will prevent the sucking of the food in the tooth. Yeah,
Yes, ma'am. Sure. Actually, ma'am, you answered my next question also. So, what
yeah.
are
Let it
periodontal
come.
diseases, ma'am? What are
Yeah,
periodontal diseases?
right. As I told you, there are two components, the whites and the pinks. The
Yes.
white that is teeth and the pink that is gums. So periodontal means that something that is surrounding the tooth, right? It is called periodontal. So that is consists of various parts like gum tissue. That is the हम जिसे मसूड़ा बोलते हैं. Gums is the one component. There are other components. There is a ligament that is present between the tooth and the bone. That is called periodontal ligament. Then it is with the periodontal ligament, the tooth is attached to the bone. So the bone that is supporting or containing the tooth root is the one of the component of the periodontium. So periodontium is consist of all these things that is surrounding the tooth, that is holding the tooth and giving support to the tooth. So if something goes wrong with that, you are going to lose the support of the tooth. So what happens with periodontal disease, there is accumulation, as I told you earlier, that there is a plaque that is surrounding the tooth, that is present constantly on the tooth. So if this plaque increases, if you don't take proper measures, the amount of plaque is going to increase. Once it increases, the bacteria are going to cause problem and inflammation with the gum. So gum is something that is superficial layer. At that time, it will lead to gum inflammation that we call as gingivitis. Now, gingivitis will lead to symptoms like bleeding gums, swelling of the gums, sometimes some dull pain in the gums. But gingivitis is reversible. If you report your dentist at this point, if you just see a small blood on your toothbrush or blood when you bite on a fruit, and you report to your dentist, this is reversible and it can be completely treated. As the bacteria or as the infection goes down in the deeper layers of the periodontium, it is going to destroy the bone that is supporting the tooth. Once the bone is lost, it is very difficult to regenerate the bone. Though we are doing regenerative surgeries where we try to regenerate the bone with the help of bone graft, it is not possible in all the cases, in all the areas. So it is always better to halt the disease at the beginning. Once it has progressed, it will lead to the recession of the gums. So because as the bone is going down, the tissue will also follow the bone. So you're going to get the recession of the gums. The root portion will be shown up in the oral cavity. As the support is lost, the tooth are going to become loose, they'll become mobile, and eventually they will fall. So with the little bit of measures, little bit of attention to your oral cavity, it is going to help you a lot. It is going to save your teeth.
Okay, okay. Ma'am, what methods of local anesthetics would you recommend to perform a surgical procedure on a patient?
Yeah, this is quite advanced question. I was expecting this little later, but anyways, see, when we are performing the dental procedures, most of the patient they come with a lot of phobia. You know, dental anxiety and dental phobia is it's very huge. So these patients have got phobia or fear because of many reasons. So most common is like the first visit, like they don't know anything about dentistry and there is a fear of unknown. They don't know what is going to happen. They have heard a lot many things from their friends. So friends and family are the feeders, and they come up with some notion. They know that they are going to be some problem. There is going to be some pain. Some drilling is going to happen. But this is not always the case. Not all the patients require anesthesia. Not all the patients require surgery. So what do you need? You need to know this. For that, you need to visit your dentist. So when the patient comes to us, we try to first calm the patient before like putting the patient disabled on the chair. Like no patient feel like they are disabled now, they can't do anything. There is a flash of light, they're lying down, they are with mouth open, they can't talk. So this is like very disabled feeling, and that's the fearful feeling as well. So before putting them on a chair, we like first talk with them. We try and make them much friendly. We create a good atmosphere. We try and solve their questions and their doubts. And after that, we put them for the investigation, for the checkups. So now next thing comes the drills and the injections. So these drills are just the noisy drills. They don't actually cause pain all the time. And whenever we expect that some procedure is going to cause pain, like some surgery or some deeper drilling is going to cause pain, we need to give the anesthesia. That is the local anesthesia to numb that much of area. So when I'm performing any dental procedure, most of the time my patient is awake with that much of area that is numbed with the help of local anesthesia. For delivering the local anesthesia, we use a small tiny injection with a very fine needle again, and that passes very very smoothly through the tissues of the oral cavity. To prevent the passage of passing ka pain as well, we apply the topical anesthesia. So this topical anesthesia is like a jelly that is applied on the area where we are going to prick. So again, the pain is reduced. Nowadays, we got certain more advanced pressure syringes wherein they actually don't cause pain at the time of injection. So there are multiple methods that can be taken and that can help you to get We can avoid the pain at the time of injection with these methods.
Okay, okay. Ma'am, what is the reason for bad breath?
Yeah, there are multiple. Bad breath in scientific terms is called as halitosis. So halitosis, the most important reason and most common etiological factor lies in the oral cavity. So if you have bad breath, you first need to visit to a dentist. So most commonly it is because of the plaque and tartar, that is the dirt that has accumulated on your teeth. Secondly, that can lead to this plaque and tartar can lead to inflammation in the gums. And if you have inflammation or infection in the gums, that can lead to some different foul smell in your to your mouth, to your breath. Then, if there is infection that has formed pus, so if there is an abscess, pus formation somewhere, it will also add up to the bad breath. Bad tongue coating can also add to the bad breath. This is all related to oral cavity, and all these things can be easily manageable. But sometimes the reason for bad breath is somewhere else. Like the patient can have sinusitis, and that's why he has bad breath. The person can have some lung disease, underlying lung disease that can cause bad breath. Liver elements, gut problems, all these things can lead to bad breath, but these are very rare etiological factors. Most common is the oral cavity. Most common is the dirt and infection in the oral cavity that is responsible.
Okay.
Yeah.
Ma'am, is chewing of sugarless gums healthy for teeth?
Yes, definitely. When you chew on a chewing gum, what happens? There is a lot of release of the saliva from the salivary gland because of this
Yes.
constant stimulation. The saliva will increase the pH. So more pouring of the saliva is better the pH. It becomes more alkaline. And alkaline pH is beneficial for your teeth because the bacteria that are harming your tooth, the bacteria that are causing the caries, they survive on the acid that is there, right? So if you increase the pH, that is alkaline pH is going to be beneficial in prevention of the caries.
Ma'am, what are the main oral health problems and what factors uh, affect oral health?
Yeah. So as I said, the oral health problems are mainly of two types. That is dental caries that is affecting your tooth, and the gum problem or gum disease that is affecting your gum. Dental caries usually start as a tiny black spot on the enamel. It goes down deeper in the deeper layer, that is dentine. It causes the cavitation in the tooth, and then it tries and reaches to the pulpal tissue. Pulp is the live portion of the tooth. So once it reaches the pulp, it will traverse all the down to the apex of the root, and it will cause infection and abscess at the root end, and it will spread in the bone, inside the bone. Now, once the infection is there or abscess is there, it will try to come out from some area, right? So sometimes it causes penetration or sinus in the bone, and it comes on the gum tissue. So you get a boil on the gum, or you get the sinus that is draining pus on the gum. So usually in the initial stages, if we treat like that, the caries is it is in the higher upper layers, we can easily treat with the help of restoration. But once it goes down and it affects the pulp of the tooth, you need to do the root canal treatment, wherein we remove the infected pulp and we try and reach to the apex of the tooth, wherein we can put some medicament and we can cure the disease. This is all about the dental caries. Now, what happens with the when this plaque and tartar and this bacterial load that increase on the outside of the tooth, that is going to affect the gums, right? So the gum disease usually has a two stages. When it is in the superficial layers of the gums, that is, it is called gingivitis. In case of gingivitis, the patient usually has gum bleeding, gums look red, they are usually having a dull pain, but the gum diseases, the gingivitis, is reversible with the treatment. It can completely go back to the normalcy. But if you neglect at this point, just because there is no pain, remember there is very less or no pain in the gum disease as there is severe pain in the tooth disease, right? In the caries. So in gum disease, there is very little or no pain. So patients usually neglect it. And once it goes down in the deeper layer, the layer that are supporting the tooth structure, that is the periodontal ligament and the bone. So that will lead to resorption of the bone or bone loss. Once the bone is lost, it is very difficult to regenerate the bone. We do some gum surgeries wherein we try to regenerate the bone with the help of bone graft materials or some membranes. We try to do that, but it is not possible for each and every patient, for each and every tooth. So it is advisable to get the gum disease treated at its first sign. And usually bleeding gums is the first sign that is visible to the patients, and patients should report to the dentist at this point of time. Because if the disease progresses, if the bone loss is like, if it progresses, it will lead to the looseness of the teeth and eventually the tooth will fall off. Apart from caries and periodontal diseases, there are certain conditions that affect the tooth, like atresion, wherein there is a vertical wearing of the tooth. The tooth goes down and down, it becomes smaller in height. It usually happens because of the habits like pan or kharra chewing or betel nut chewing. It can also happen because of night grinding. Some patients have got habit of clenching their teeth at night when they are sleeping. Sometimes it can also happen because of some occlusal disharmony, some tooth or some filling or some crown is not fitting properly, that can lead to wearing and adjustment of the other teeth. This is about the vertical wear. There is a wear that happens on the sideways of the tooth, especially at the scallopings of the gums. This is called abrasion, and this usually happens because of faulty tooth brushing. There's another condition of wear that is called erosion that happens because of a lot of acid in the saliva. That usually is seen in the patients who have got disturbed gut because of regurgitation of the acid or hyperacidity syndromes. So these patients can have erosion on the front teeth. Patient can also have malaligned teeth. That is also one condition that is affecting the beauty or aesthetic of the patient. So they will have a crooked teeth, malaligned teeth. All these things can be corrected.
Okay, okay.
Yeah.
Ma'am, as a
And the
dentist,
factors, yeah, you were asking me the factors that can influence the
yes.
oral health. So the most important factor is the oral hygiene measures, the way you brush your teeth. That is very important factor that is responsible for the health. Second, some underlying disease like diabetes or AIDS or some skin disease that can affect your gums. Some medicines that patients are taking, some anti-epileptic medicines, some anti-hypertensive medicines can cause gum enlargement. Genetics has got a huge influence on the oral health. The patient's socioeconomic status, the psychological status, and educational status also has got a huge impact on the oral health. So through these videos, through all these communications, what we try to create an awareness to all the media, right? To all the people of whether even if they are educated, they are sometimes neglecting the oral health, maybe because of fear or maybe because of some other reason. So we want our patients to visit the dentist at least 6 months, because not all dental conditions will cause pain, and that you not need to wait for the pain to happen and to go to the dentist, right?
Yes, ma'am. Correct. Ma'am, as a dentist, you have to treat patients who are deeply uncomfortable or even afraid of
Yeah.
getting dental work. So, ma'am, how do you make your patients relaxed or feel safe?
Yeah, as I told you, I give enough time to my patients. I usually speak a lot about their conditions, and moreover, I speak a lot about their fear factors. So most of the patients they have dental phobia or dental anxiety. Most common is the fear of unknown. They don't know what is going to happen to them. That's the big fear. Apart from that, there is a fear they got to learn something from their peer, from their friends and family, or maybe they just past a bad experience about the dentistry.
Uh,
I think
Ma'am,
it has stopped again. Yeah. So because of their past traumatic dental experiences or someone else's experience, they are fearful. So where I put them on the chairs, I try and make them relax. First, we talk about the problems, we talk about general things first. They develop the trust in me, then only we start with the treatment or checkup or whatever we are planning on that particular appointment.
okay.
I also encourage music therapy, in putting the music in the clinic, or just asking the patients to put the headphones and listen to the music of their choice. This helps a lot. It will prevent the drilling sound reaching them, and it also soothes them. It's a comforting thing, right? Also, they can come with someone else they trust, like they can get someone with them, their friend or family member, for the first appointment at least. Because later on, once they develop a trust in us, we are sure that they're not going to need anyone else.
Yes, ma'am, correct.
Yeah.
Ma'am, you have treated so many patients. So you may have come across some funny patient. So please share your incident.
Yeah. Yeah, there are certain, but there are few. I can remember a couple of them strikingly. So there was this lady who was in her 60s. She came here for overall general checkup, and the dental checkup was just a part of that health checkup plan. So when she came to me, she was like, "No, I don't need to actually get this done because I'm fine. I don't have any dental problem." So I was like, "That's fine. Let's just sit and let's chat for some time till the time I get my next patient." And then she was like, we were chatting, and she opened up gradually, and then she was laughing at some point when her denture fell off. So I was like, she got embarrassed, right? She was very nervous at that point, and I was like, "Ma'am, you said you don't have need a dentist." But your denture, if your denture is falling off, you need to see a dentist. Then she was like, "No, I get this gag problems. This is once done. Now I don't. I want to continue this." But then I encouraged. I told her about the materials, the new materials, the new techniques that we are using to prevent this gagging problem. And then she was cooperative. The next appointment, we did the impressions, and we could deliver a nice fitting denture to this patient. So she was a very happy patient. Now still in touch. Yeah,
Nice.
yeah,
So, ma'am, as we know, okay, you have done smile designing. So, give some
yeah.
tips for perfect smile. How to,
Yes.
you know, how to do it.
Right, right. Frankly, the smile that is healthy is perfect, right? But whatever perfect I feel need not to be perfect for my patients. So perfect smile usually means a perfect balance between whites and pinks. So whites are your teeth and pinks are your gums. So if you have a perfect proportion of these two, if you have perfect shape of these two and perfect alignment, then you are going to get a perfect smile. So as far as the teeth are concerned, so if your teeth are crooked, if they are malaligned, we need to align them properly in order to get the nicely aligned smile. If there is any breakage or any broken tooth or chipped off tooth or wear of enamel, we can build this tooth to their perfect anatomy. We can put the laminates on this tooth. If the tooth is worn out completely, if it is a smaller size, we can put a crown on this tooth. Exactly the matching color, we match texture, color, everything when we deliver the crown or the laminate. If you have problems with the gum, like for example, if a patient has a gummy smile, there is excessive display of the pinks, right? So these patients have very small white teeth and more of the gums are showing up. So they are very conscious, they don't smile much, they put a hand and they smile. So because of excessive display of the gums. So we can cut these gums, we can give a perfect scalloping of the gums to this patient, we can trim them and shape them nicely, and we can deliver a perfect smile. If there is blackening of the gum, we can do the surgeries, the lasers, and the scalpels can be used to remove the black lining on the gums, and we can deliver a pink smile again to our patients. Similarly, if the teeth are stained, if there are superficial stains, can be removed with the help of scaling. If the tooth is discolored, we can do, for the initial stages, we can do bleaching to give nice and white teeth. Or if they are like badly discolored, we can put the laminates. So this is how we can design the smile very perfectly, a perfect balance between white and pink. But obviously,
Okay.
health is the most important thing. I always say it
Yes.
has to be healthy. Yeah.
Yes, ma'am. Correct. Ma'am, what tips would you like to give us for developing better hygiene?
Yes. So I think I'm repeating this, but yes, it's very crucial. So you need to brush twice a day minimal. So what is ideal is brushing after every meal. But if it is not practically possible, at least brush twice a day with a fluoridated toothpaste. The toothpaste should have 1000 ppm of fluoride at least. Apart from that, for the interdental areas, you use a floss or the Proxa brush. Now, the choice of floss or Proxa brush depends upon the space. If the interdental spaces are wider, you need to use the Proxa brush. If your teeth have tight contacts, then still you need to clean them, but you need to clean them with the help of a dental floss. So flossing and brushing will cover the entire tooth area and you can clean the tooth area. Apart from that, you need to clean the tongue. if you have certain problems, your doctor can advise you the use of certain mouthwashes. Using mouthwash is not necessary for each and every one of us, right? It is
Yes.
just for a therapeutic purpose. If you need it for certain reason like inflammation, sensitivity, then they specifically doctor will recommend this to you. While brushing, the technique of the brushing is the most important than anything else. You don't need those fancy toothbrushes to clean it nicely. You just need to practice a proper technique. And you can learn this technique from your dentist who can teach you how to brush perfectly, how to reach each and every area of your oral cavity. And you can do that. Again, the choices of the food is going to help you a lot. You try to incorporate raw food and fruits in your meals instead of a sticky and sugary food stuffs. Avoid chewing gutka, kharra, avoid smoking, drink plenty of water. All these things should help.
Yes, ma'am.
And visit the dentist every 6 months. That is again a very important thing. Because again, as I said, you usually visit only when there is pain.
Yeah, correct.
But there are certain silent conditions which are there and which can affect your entire body silently. So you
Yes,
need to
ma'am.
visit, right? Yeah.
Correct. Ma'am, it is excessive brushing fades the color of teeth. Is it true or not?
Fade the color of the tooth.
Yes.
Fade means the
Yeah.
tooth becomes lighter. Do you mean
Yeah,
that?
lighter. Yes, ma'am. It is a myth. Everyone says,
Excessive, no. See, excessive brushing. See, rather what can happen if you brush excessively or harshly, what can happen? It can cause wearing of the tooth, right? Like I said, it can cause wearing in maybe in the certain areas. You will lose the enamel. So once you lose the enamel, the dentin will show up. Now the dentin is little darker color bay. So dentin is usually a one shade dark. It is yellowish in color as compared to enamel. So on the contrary, if you brush aggressively, your teeth should look yellowish in that particular area where you are putting a lot of pressure. Because the enamel has gone, the dentin is showing up, which is yellowish in color. It is not at all going to fade the tooth. Now, this is about the excessive brushing, right? But if you have certain mild stains, right? The Indian food has got lot many colors, the haldi and all that.
yes.
So they are causing staining of the tooth. Now this is extrinsic stain, right? So this is incorporating in the plaque and this is forming a layer on the tooth. So a nice brushing can clean these stains. So daily perfectly nicely done brushing will clean the stains that are extrinsic stains. Per se the tooth color is not going to change, right? Excessive brushing can lead to wear and you can see more yellowish tooth, not the faded tooth. No.
Okay, ma'am. Okay. Thank you so much, ma'am. It was a pleasure for us to have you in our session. I once again thank you, ma'am, and the audience in front of the system. Keep following us for the updates of the session. Thank you so much, ma'am.
Thank you
It
so
was
much.
really a good session. It was very knowledgeable, and we have gained a lot of knowledge of our oral health, and it's very important to keep our oral health healthy. Otherwise,
Exactly.
it will cause really great problems, big
Exactly.
problems.
True.
Correct,
Yeah.
ma'am. Thank you so much,
Thank you so
ma'am,
much. Yeah.
for being a part of our health talk session.
My pleasure.
Thank
Bye.
Welcome to Rise Group, a vision beyond.